The BOCC report is sponsored by Jim Marsh Automotive of Las Vegas, Kia, Chrysler, Jeep, and Body Shop.
So these are some pictures from our team in White Pine and in Nye and Esmeralda County. So this was a medical dental integration project. We were bringing preventive dental services and immunization services to rural Nevada. This was a collaborative effort with the Southern Nevada Health District and the Division of Public and Behavioral Health. And we were focused on health professional shortage areas, and most of the rural and frontier counties in Nevada are considered health professional shortage areas. And in order to meet those needs of those counties, innovative methods and approaches are really needed. And so we were going to use a public health endorsed hygienist for this project. A dental hygienist is to a dentist what a nurse is to a physician, and dental hygienists in the state can apply for an endorsement, which allows them to have an expanded function and to work without the supervision of a dentist.
So immunizations were provided for uninsured adults, privately and publicly insured adults, and privately and publicly insured children. For the most part, there is a program called Vaccines for Children that the state health nurses that are assigned to the various rural counties provided, but they couldn't provide for the insured clients. So we brought along vaccines that we could charge for insured clients. Otherwise, they wouldn't have gotten the vaccines. There was a very high demand from both adult and senior populations, so you can tell that I'm beyond the adult stage myself, so there are vaccines that people my age and perhaps some people on the county commission would be eligible for that the average adult resident wouldn't be eligible for, and Shingrix is one of those to help to prevent an outbreak of shingles. And that's the most administered vaccine and wasn't really available through the county and the state nurses.
So some of the key challenges that we faced, obviously the state plan amendment that's needed for Medicaid is a barrier. We did have some trouble with the schedule. This was just a 3-month trip, so it was everybody had to be very flexible with scheduling this. We did have equipment that broke down, and so we had to be aware of that. Kind of setting realistic goals. Since we were asked to provide expanded services, it was very difficult because we didn't have all of the supplies that we needed, but we tried to do the best that we could to meet the needs of the county. So looking forward, we are continuing with the state plan amendment. The Southern Nevada Health District now has a dental clinic that's continuing from this. We are looking at introducing teledentistry language into the NRS and the NAC, which would allow dentists to provide telehealth services in rural counties. We are also looking at possibly launching some new projects, possibly a rural school sealant project, providing oral health education and screening in rural licensed child care centers, and we've also been looking for some funding for a rural OBGYN educational outreach project.
This is not an action item. However, I see no reason why we couldn't request staff to help us compose a letter of support for what they're doing.
Yes, please.